Meeting a basic need like healthcare is a big challenge in Bangladesh. Patients often have to bear more than half the cost of medical expenses from their own pockets. These patients number into the millions, and health-related debt pulls another 5.7 million people into poverty every year. In response, BRAC has started the Health Security Program, providing a way for any low-income family to access reliable, quality healthcare. People pay different premiums according to their income and assets. A health security card gives benefits like annual health checkups for household members over 35 years of age, 3 free consultations with physicians annually, cash subsidies and 25% discount on diagnostic tests, medicine, 2 prescriptions of 50 taka each annually, various cash subsidies for clinical procedures.
We started this program for several reasons, to test for ourselves whether such a program can be implemented now. The second was that BRAC is scaling up its programs. So if it is found to be successful, then we would be able to scale it up across the country very fast. Thirdly, that the government, which is supposed to be taking the main lead in implementing a universal health coverage program, they are gradually becoming interested in universal health coverage, but they don't have any experience on these. If we have some experience, then we can also transfer those experience to the government. The Rockefeller Foundation, we are grateful to them. They came forward to support it for the initial few years.
এক বছর হলে এই সেন্টারের খবরটা মনে করে আমি পাইছি। আমার এই বাসাতে আসার পরে আমার স্বাস্থ্যকর্মী আপারা আসে আমাদের বললো, ইউটিউবে আপনি একটা কার্ড করেন, কার্ড করলে আপনাদের সুবিধা অনেক কিছু পাবেন। তো আমার স্বামী আসলো, স্বামীকে জিজ্ঞেস করলাম, স্বামী বলে যে না, এগুলো কিছু করা লাগবে না। পরে আমি বললাম, আপা আমার স্বামী তো রাজি হয় না, তো আমি যদি করি তাহলে আমি তো 2 কিস্তি 3 কিস্তিতে টাকা দিব। বলে হ্যাঁ করেন, করতে পারবেন। কিছুদিন পর আমার গলাতে ঘা হয়, ঘা হলে তখন আমি এই ব্রাক সেন্টারে গেলাম। সব রোগী ফেলাই দিয়ে আমার কার্ডের রোগীরা আমাকে আগে দেখলো, দেখার পরে আমার কোনো ভিজিট লাই নাই।
One of the Sustainable Development Goals is achieving universal health coverage. The BRAC Health Security Program is a first step towards making that a reality in Bangladesh.
Universal health coverage is actually reflected in the healthcare financing strategy, which will be implemented over 20 years. Whole population is classified in 3 groups. One of the main groups, and most of the people actually in that group, is the informal sector.
Health security cards are hitting the roads of Bangladesh through shows, popular theatres, commercials, and BRAC's community-based health workers, the largest network of door-to-door health workers in the world.
প্রতিদিন ফিল্ডে যখন আমি খানা ভিজিট করি, তার সাথে আমি হেলথ কার্ডের সম্বন্ধে মানুষকে বোঝানোর চেষ্টা করি, কথা বলি তাদের সাথে। তখন তাদেরকে বলি যে নতুন একটা প্রোগ্রাম আসছে আমাদের এখানে, এবং একটা কার্ড করলে সে 1 বছর সুযোগ সুবিধা পেতে পারে।
যারা বিএসপি কার্ড হোল্ডার তাদেরকে আলাদা বসানোর ব্যবস্থা করা হয়েছে। সবার প্রথমে দেখানোর ব্যবস্থা করে দেওয়া হয়। তো ওনার রিপোর্ট যা কিছু আছে সব কিছু আমরা চেষ্টা করি সবার অগ্রাধিকার ভিত্তিতে সেবা দেওয়ার জন্য।
We hope to halve the percentage of people bearing their own medical expenses by 2032. The program has only been implemented on a small scale so far, but we have seen the popularity of health security cards increase. Research shows the health security cards have considerably reduced out-of-pocket spending already.
We knew from experience that the voluntary health insurance is not very successful anywhere in the world. Given the peculiar situation that BRAC has created in the villages, we might be successful to see such a voluntary scheme works.
The program faces multiple challenges, like the informal nature of the target group, lack of acceptance of the concept of prepayment, adverse selection in enrolment, and the scarcity of quality service providers.
The NGO community as a whole has also a role to play in this. In any insurance program, the pool, the number of people who are brought in under insurance is important. So if we think of microfinance, the main 3 players of Bangladesh, Grameen, Asha and BRAC, they together reach about 20 million households in this country. So if they come together and start a health insurance program for their beneficiaries, then it can become a very powerful platform.
But without having the national involvement, that means government either having a leadership role, giving guidance or getting directly involved, or encouraging the other stakeholders. So partnership and leadership role of the government is very important to run insurance model. Whether SDG is saying universal health coverage, post SDG will be bringing another word. So we should not, as a Bangladeshi, wait for all those words, because this is a right issue and everybody should have the rights to have a better quality healthcare.
BRAC is familiarising the concept of prepayment in the community and developing operational expertise to run other social protection schemes to move towards achieving universal health coverage. The concept of investing in health, of putting money away for getting sick in the future when you feel healthy, is completely new in Bangladesh. Although there have been many challenges, health security cards are getting a lot of interest, both at the national and at the grassroots level. We all know that we will get sick at some point in the future, and when that does happen, we all want the best service available. Having a health security card guarantees that, no matter who you are. Health. We all get sick. It's scary. When you can't pay for it, it's a lot scarier. Let's make universal health coverage a reality for everyone in Bangladesh. BRAC. Join the world's biggest family.